I'm Dr. Anshuman Manaswi, and I'm a plastic surgeon and a lymphedema surgeon speaking from La Transformation Plastic Surgery Center, Mumbai. Today we will be demonstrating the technique of manual lymphatic drainage, which helps in decreasing the lymphedema. Manual lymphatic drainage is a special type of massage which opens up the collateral or dormant lymphatic channels through which the lymph can flow, and thus the lymphedema fluid which is accumulated gets reduced. So she is my staff at the clinic, and she is kindly consented for the demo. So let's begin. So lymphedema massage, the manual lymphatic drainage, which is a part of decongestive therapy for lymphedema, consists of 4 stages. Number 1, we have to open the proximal lymphatics. Only when the proximal lymphatics are open, the gates are open, then only the fluid can pass through from distal to the proximal part. The second step is starting the massage from distal to proximal, and the third and fourth step are to press the lymphatics from distal to proximal. So let's see how it happens. Now suppose somebody has got a lymphedema of the upper limb, the swelling. There is a huge swelling. Now the technique for lower limb is similar, but at a lower leg. So we have to understand that there is a blockage over here, mostly because if it is because of the glands removal or because of obstruction, the glands are situated over here, even if there is an obstruction. So this is the portion where the glands are situated and they are obstructed. So we have to open the channels like this. Underneath the skin, the fluid has to go. Whether it is pushed under the tissue or pushed through the lymphatics, collaterals, both sort of act to finally give the effect of decrease of the swelling. So first we have to make sure that this portion is soft. Okay, this is the proximal portion ahead of where the lymphatic obstruction. The lymphatic obstruction is somewhere at this level. So we open like this. That is the first thing. Okay, and this layer here, the lymphatics are there. Beyond this, so this channel has to be opened. Some people can start even from this side, the other side. Okay, so let's for the timing understand that we are starting from here. Then this portion we are gradually massaging. Okay, gradually massaging with not lot of pressure. These are to mobilize the lymphatics so that they sort of open. Okay, so now gradually I will come down like this, circular motion, like this, from under surface, like this, like this, like this, then turn like this, like this, like this. I'm going a little fast for the demo purpose, but one step of this circular motion from this side or this coming till here should take at least 7 to 8 minutes, not less than that. Now that these lymphatics have become loose, we have to make sure that these pipes are empty. The lymphatics are empty. How do we do that? We first press the lymphatics from this area to the supraclavicular area, the upper area. So now this fluid is coming till here. This is becoming empty. Now this to this, this to this. Now this will become empty. This to this, this to this, this to this. So short steps of small massage of lymphatics. You can do like this or you can do like this. The first is like this, which is much better. Not like this, because here we might not have opened. First we open and then we press. Alright, so we are coming short segments like this, then like this, then this segment, this segment, this segment. Okay, like this. Right, the fingers like this, like this, like this, like this, like this, like this. Now this is the second step. Third step is now little longer one, press like this, open like this. Okay, keep pressing. Bigger ones. Okay, like this, like this. Press, turn, keep pressing. Little longer movement. Okay, and the fourth one is again from distal to proximal to press. So it is short, 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 short. Right? Like this. Now, obviously in a thick-skinned lymphedema, more pressure will be required. Okay. So now we are going from this to this. Okay. This movement, the last one, can be repeated again. Little. Now there is one trunk of lymphatics which comes like this. In many patients, almost 30% of the patient would have this kind of additional trunk of lymphatics compared. Normally, one is constant, this is variable. When you are pushing this, many of the patients, these lymphatics will open and start draining. So, this is what it is. After that, make sure that you give a physiotherapy of the shoulder joint, elbow joint, okay, fingers, and the wrist. So this has to be done by a physiotherapist or a trained lymphedema therapist. We train the people for lymphedema treatment and the therapy as well. So anybody interested can contact us for learning these techniques of lymphedema, manual lymphatic drainage and 4-layer bandaging and other things which come with lymphedema non-surgical management, and we'll be happy to help you guys. Thank you so much for patiently listening. Thank you.